All right, welcome. So in this discussion, we're going to focus on the meninges. The other discussions, we looked at the topography of the nervous system, just looking at the surface features. We talked about the lobes of the brain. We talked about the parts of the brain. We also looked at the spinal cord and also division of the nervous system. Now we're looking at the meninges. So meninges, these are protective covering that we find in the central nervous system. So their major function is to support, at the same time, protect the central nervous system. By this time, we know that the central nervous system is brain and the spinal cord. In addition to that, we have other structures protecting the brain and the spinal cord. Mainly, it's a skeletal system. To be specific, we have the cranium protecting the brain. Then we have the vertebral column protecting the spinal cord. So you see that this system is well protected by bones. Now, since these bones are hard substance or tissue of the human body, whereas the brain and the spinal cord are soft tissues, to prevent friction between the two, that is the brain, spinal cord, against the cranium and the vertebral column, respectively, we have meninges. Collectively, there are three, namely the dura mater. I'll be pointing at it. That's the dura mater. Next is the arachnoid mater, here shown in gray, grayish bluish. It should be indigo or something, that layer. Then we have the pia mater, here shown in red. So pia mater innermost, arachnoid mater middle, and dura mater external. Now, there are also spaces between the meninges. So the first space I would like us to think about is a space between the dura mater and the cranium, that is for the brain. Then dura mater with the vertebral column, that is for the spinal cord. I have a diagram somewhere here. This is the dura mater of the spinal cord. So around this, there will be vertebral column. So that is dura mater. Now, the space here between the dura mater and the vertebral bone is the same as the space between the dura mater and the brain. That minute space here. So we call that space as the epidural space. Epidural space. That's space number one. Next space is space between the dura mater. So here you observe that dura mater has two layers for the brain, but dura mater of the spinal cord has single layer. I'll explain that sooner. So now, between the dura mater and the arachnoid mater, there is a space here. So this time we'll call this space as subdural space. The first one was epidural here. Next is subdural space. This is arachnoid mater. Now the space here is subdural space. The third space is now between the arachnoid mater and the pia mater. So this is a pia mater. This is arachnoid mater. This space here, you can see that it's quite substantive. It is the largest space of the meninges. We call that as the subarachnoid space. Subarachnoid space. Now, of particular importance, the subarachnoid space is a space in which we are going to find blood vessels running to and from the brain. So blood vessels supplying the brain, blood vessels draining the brain, that is arteries and veins respectively, will be found in the subarachnoid space. In addition, since this space is quite substantive, it is large, as you can see here, this same space contains a special fluid or special interstitial fluid of the brain called cerebrospinal fluid. So cerebrospinal fluid will be here. That is interstitial fluid of the brain. Okay. Sure, you have heard of swelling of the brain. You find that fluid here begins to accumulate. Sometimes there's infection in the brain. You find that there's contamination of cerebrospinal fluid there. Okay. And when diagnosis is being done, that fluid is drained from the level of the spinal cord between L5 and L4. L5 and L4. This is a cauda equina, this is L1, so this is L2, L3. 3 and 4, even 3 and 4 you can drain here to enter into that space and collect cerebrospinal fluid and be able to examine at all if there are any infection there, blood, or any other type of abnormal deposit, right? So those are the 3 spaces and the 3 meninges. Okay. So let's look at these meninges now one by one. So we'll start with the dura mater. Dura mater, which is the outermost meninge. So it's called dura because it's tough. So it's called tough matter. In other terms, it can also be called the Pacai meninge. Pacai meninge is these 2 layers of the dura mater. That's a Pacai meninge. So you hear of Pacai meningitis. It is inflammation or infection of the meninges confined only to the dura mater. That is Pacai meningitis. Then you also have leptomeningitis. This is infection or inflammation of both the arachnoid mater and the pia mater here. So both of these layers are knocked out. So in terms of thickness and toughness, dura mater is the thickest and toughest, followed by arachnoid mater. The pia mater is very thin and is very fragile, and it is always adherent to the brain surface. So it's very difficult to peel it off from the brain surface. It's almost blends with the surface of the brain. So these are gyrus of the brain, these elevations, then these are sulci. So you see that the pia mater follows the gyri and sulci of the brain. Now, in the brain, the meninges, we're saying there are 2 layers. So there's an outer layer and an inner layer. So the layer of the dura mater that is closest to the bone, the cranium, we call it the periosteal or endoosteal layer of the dura mater. So this is a layer we're looking at. It is continuous with the cranial bone. Okay, you see that it even overlaps the sutures because these 2 bones develop from either side and then fuse at the sutures here, midline of the skull. But its meninge overlap. So the meninge that is developing with this bone from this side and the meninge that is developing with a bone from the other side will fuse there at the midline of the suture and form a single meninge. So there's no discontinuation. It becomes closed off like that. Now, if you observe, there's another layer here, the inner one. We call that as a meningeal layer of the dura mater. Meningeal because it is closer to the other meninges. Now, observe that the meningeal and the dura and the periosteal layer split to give us 2 sleeves. The inner sleeve, this one, and the outer sleeve, that one. Now, the gaps left by the meninges, we call them cisternae. Okay, we call them cisternae. So, for example, here we have the superior sagittal cisterna. Superior sagittal. There's also an inferior sagittal cisterna, which is somewhere here in the inferior end. So, again, the 2 will split and form another space. So, we call those as cisternae. Now, what we find there is blood. Deoxygenated blood. So cisternae, if I can borrow your attention, cisternae are as good as veins. Look at that, that's a vein. Look at that, that's a vein. Now, these differ from veins in that it's more like a pool, a very large area of deoxygenated blood created by space left between the meninges. So, blood that is in the cisternae and blood in the veins here must go back to the heart. So somewhere, the cisternae and the veins will connect. And we know that there are two large veins that collect blood from the head region. You have the internal jugular vein and the external jugular vein. Internal jugular vein collects blood from the brain substance itself. Then we have the external jugular collecting blood from other parts of the head, the muscles, the skin, and other parts of the skull, not the brain itself. The brain, we have the internal jugular. Now, another difference is that the cisterna will not have any valves. So there are no valves here, but in the veins, we have valves. And valves allow one-way flow of blood, that is towards the heart. But we don't have valves in the cisternae. That doesn't mean blood can flow back and forth in the cisternae, no. Because of the pull, gravitational pull itself, and the pressure exerted by arterial blood flow, we find that blood in the cisternae always moves in the direction towards the heart. So that is a vein you are seeing there, a very large vein known as the superior sagittal sinus. Superior sagittal sinus. There are so many of them. We'll mention some of them as we go on towards the end of the session. So that's what I wanted to mention. Now, when we observe the meninges in the spinal cord, we see that that sleeve is not there. So we don't have that sleeve. We don't have the sinus here. It is one meninge. So the periosteo and endosteo, periosteo or endosteo layer of the dura mater disappears in the spinal cord. So the spinal cord only has one layer of dura mater, unlike the brain, which has two layers. So this is the arachnoid mater. Then that is a spinal cord. That glass-ish appearance you're seeing there, that is a pia mater. And the space between arachnoid and pia mater is a subarachnoid space. And I said this is where cerebrospinal fluid will be found together with blood vessels. Okay. So this is the toughest one. Very tough indeed. All right. So that's about the dura mater. Now, dura mater has folds. Okay. So these folds accompany the shape of the brain. Now remember, brain has those parts. Brain has telencephalon, which is the cerebrum. Brain has diencephalon, which is epithalamus, thalamus, and the hypothalamus. Brain also has the cerebellum. Brain also has the brain stem, which is midbrain, pons, and medulla oblongata. Okay, now, these folds follow the cerebrum and the cerebellum, right? So, if we can beg your attention again, we'll see that the telencephalon, or what we call the cerebrum, is split into two hemispheres, a left and the right hemisphere. In between the two hemispheres is a layer of dura mater. You see that inner layer and inner layer from the other side. When they come here, they fuse and then split. So this is the left hemisphere, that will be the right hemisphere. This layer of dura mater is known as the falx cerebri. Falx cerebri. Okay. Falx cerebri. I think I have those words. I just want you to see. Falx cerebri. Where are those? Yeah, falx cerebri. It separates, or rather divides, the two hemispheres of the cerebrum. So that's the structure there. So you have the two hemispheres split in half by the fork cerebri. Then we also have the tentorium cerebri. Tentorium cerebri, which you can see here, separates the cerebrum from the cerebellum. So the cerebellum will be here. Cerebellum will be here. Cerebrum will occupy all that space. Now, this layer of meninge here, cutting like that, we are seeing it from the top now here. So above the tentorium cerebri, above the tentorium cerebelli, above it is the cerebrum. Below it is the cerebellum. Tentorium cerebelli. Below it is cerebellum. Above it is cerebrum. Then this, what we are seeing here, is the forks cerebri. Now, even the cerebellum itself has two hemispheres. It has a left hemisphere and the right hemisphere. And the dura mater splits the cerebellum into two hemispheres, the left and the right one. So that dura mater will be called now as the forks cerebelli. Forks cerebelli, this one here. So on our end here, it will be, for example, the right lobe or the right hemisphere of the cerebellum. On the far end there, it will be the left hemisphere of the cerebellum, split by the forks cerebelli. So take note of the difference in nomenclature here. Forks cerebelli, forks cerebri, cerebra, cerebellum. Then finally, we have the pituitary gland. And we're saying the pituitary gland is contained in a shallow depression of the sphenoid bone known as the sella tussica or hypophyseal fossa, or some books will say pituitary fossa. That fossa there. Now, instead of completely cutting off the pituitary gland from the diencephalon, you find that the dura mater encircles around it. So it will leave a gap, more like a keyhole space, through which the stalk or the infundibulum, that extension, the infundibulum of the pituitary gland will pass through to hang the pituitary gland to the rest of the diencephalon. So we call that opening in the dura mater as diaphragma sellae. Diaphragma sellae is getting the name sellae from sella tussica. That depression you're seeing there is a sella tussica in which the pituitary gland is found. That is a pituitary gland. That space there is a sella tussica. Then the opening in the dura mater where the pituitary gland passed through, we call that as diaphragma sellae. Okay. So those are the folds and openings found in the dura mater. Forks cerebri, separating the two hemispheres of the cerebrum. Tentorium cerebelli, splitting the cerebellum from the cerebrum, which is above. So above the tentorium cerebelli is the cerebrum. Below it is the cerebellum. Then finally, you have the forks cerebri. Forks cerebri divides the two hemispheres of the cerebellum. Then finally, we have the diaphragma sellae, which is an opening in the dura mater through which the pituitary gland passes through with its infundibulum. So arachnoid matter, we're saying this is delicate and impermeable. Okay. In terms of thickness, it's quite thinner than the dura mater, but thicker than the pia mater. All right. Cardinal is that between the arachnoid matter and the dura mater is the subdural space. I explained that earlier on. Then another key takeaway is that between the arachnoid matter and the pia mater is a subarachnoid space where cerebrospinal fluid is found and blood vessels running in and out of the brain are found. Okay. So nothing more special about it other than that. This is a arachnoid matter, subarachnoid space, cerebrospinal fluid plus blood vessels. Then finally now we have the pia mater, which is always closer to the central nervous system, the closest one. You can see that layer there, that is pia mater. Again, here we have pia mater, that is a pia mater. Right. Okay. So these are just talking about the spinal cord. Of course, we're saying the terminal end of the spinal cord is known as conus medullaris, and this is found at the level of lumbar 1. So this is the vertebral bone in the lumbar region known as lumbar 1, 2, 3, 4, 5. Then after that, we go to the sacrum, also 5. So that is L1, where the conus medullaris ends, of the spinal cord ends. Now, the extension of the spinal cord, known as the phylum terminale. So that is the phylum terminale. You see like a very long strip like that. Okay. So it's a remainder of the spinal cord. Okay. So it attaches the spinal cord to the vertebral bones so that the spinal cord is stabilized. Phylum terminale. Okay, there's one strip there at the center. Then what extends now from the tip of the spinal cord is what we call cauda equina or horse tail. Okay, cauda equina. So all these nerves are coming out from the inferior end of the spinal cord. This is the inferior end of the spinal cord. Then a small strip continues like that. So even if there's damage to the phylum terminale, it's not like there's injury to the spinal cord because that is not function. It's more like a connective tissue of the spinal cord. Okay. And it is covered with the pia mater, but not with a arachnoid, not with a dura. Because the dura doesn't cover that. The dura will end here at the conus medullaris, right? So when lumbar puncture is being done, always we try to avoid injury to the spinal cord. So you can't enter at the level where there is lumbar 1 and lumbar 2, and you want to get cerebrospinal fluid. Chances is that the needle will go all the way and damage the tip of the spinal cord. That will cause paralysis and may affect physiological function in this person. So you always go a bit lower. So that is 1, 2, 3, 4. So 3 and 4, you can enter there. Or indeed 4 and 5 have access to the cerebrospinal fluid. Okay. So here you can see clearly the phylum terminale in green all the way to the tip of the coccyx to stabilize the spinal cord. All right, but it is not spinal cord itself. So even if there's injury to it, no paralysis whatsoever will be seen in that person. All right, so we look at the pia mater. So we're saying it's transparent and very thin, composed of mesothelium. So mesothelium is simply epithelial tissue composed of simple squamous cells. And this covers, cavities as membranes. So we find it in the digestive system as peritoneum. We find it in the pelvis also as peritoneum. Here it is working as pia mater. So you can see the brain underneath it. So here the pia mater has been ripped off, so we can see the brain tissue without the pia mater here. But this is brain tissue with pia mater. All right. Then finally, we can look at blood supply to the meninges. So there are 3 main arteries supplying the meninges, and all of them come from the external carotid artery. When we're discussing our circulatory system, I mentioned to say the internal carotid artery is the main artery of the brain tissue. So the brain does not benefit from the external carotid. Blood that goes to the brain comes from the internal carotid. Then the external carotid will now feed all these other parts. Muscles in the jaw, muscles in the face, skin, on the head. Anything that is not brain but is on the head and neck will be supplied by the external carotid. Then inside there, the brain fed by the internal carotid. Now, when the internal carotid enters in the sends branches inside the skull, it sends 3 of them, an anterior one, a middle one, and a posterior one. So we call these as meningeal arteries. So that is the middle meningeal artery, anterior meningeal artery, and that will be posterior meningeal artery. All of these are supplying the meninges, the dura matter, to be specific. It's a living tissue, even though it's made up of entire fibrous connective tissue. Okay. Then venous sinuses, I was saying, these are spaces now left by the dura mater, and also sometimes left by the arachnoid mater. Okay. So this is superior sagittal sinus. I explained earlier on how it is formed. And we're saying blood in there is deoxygenated and it has to be taken back to the heart, then pumped to the lungs for reoxygenation. Now, observe one thing here, that within the skull, there are tiny, tiny perforations that extend all the way from the external surface of the skull into the internal surface of the skull. And these perforations actually also perforate the outer layer of the dura mater, which we call the periosteal or endosteal dura mater. We call these as emissary veins. Emissary veins, more like messengers. Okay, so that simply means that there's connection or communication between the blood vessels inside the skull and the blood vessels outside the skull. This is the skull, the bone itself. Blood vessel, the veins communicate with each other. All right. So what that means is that, for example, there's infection of a hair follicle or any other means. There's infection in the skin here, and then pus forms and so on and so forth. And that pus has living as well as dead microorganisms. Those microorganisms can find their way by spreading through these emissary veins back or all the way into the central nervous system. This is outside the central nervous system. This is inside. When there's infection here, definitely there will be Parker meningitis first, infection and inflammation of the dura mater. Then can be followed by leptomeningitis, where the arachnoid as well as the Pia mater are affected. Essentially, the brain also becomes affected in encephalitis. So that is possible because of these emissary veins that communicate with the central nervous system. So today we end here. In our next session, we'll look at the ventricular system of the brain, and then we also look at formation of cerebrospinal fluid. Thereafter, we can now look at each individual lobe of the brain and what type of function is restricted or mapped on that lobe of the brain. For now, we can end here. And if there are any questions, as usual, you can reach out to me.